In the northeast corner of Florida, nestled between Jacksonville and the Georgia border, lies a resilient community known for its charm and beauty, where small towns meet farm fields and sprawling oak canopies, and generations of families live, work, and grow together. Nassau County is made up of tight-knit communities, places like Fernandina, Yulee, Callahan, and Villiers, each filled with a deep sense of pride shaped by its history, geography, and the strength of its people. But like many rural communities across America, Nassau County also faces a quiet challenge. In the county's quiet rural stretches, a growing crisis has touched the lives of countless families: Neonatal Abstinence Syndrome, or NAS.
Neonatal Abstinence Syndrome, or what we call is NAS, NAS, it kind of reminds us of what we used to call previously, refers to substance-exposed newborns, where what happened was individuals, parents, or mothers would use substances previously, and it would impact the child in the womb. And then what happens is, once the child is born, then they have some certain type of symptoms from the NAS. So it's like the child is almost kind of coming up withdrawals from the actual substances.
And in rural communities like Nassau County, barriers to care, from transportation to healthcare access to stigma, make it even harder to ask for help. That's where the Rural Communities Opioid Response Program Neonatal Abstinence Syndrome, or RCORP-NAS, steps in. In 2023, the St. Johns River Rural Health Network was awarded the RCORP-NAS grant to improve systems of care, family support services, and addressing social determinants of health in Nassau County.
These services offer a great deal of support for families. We are able to provide kind of wraparound services.
From the moment an individual or family first connects with an organization participating in the RCORP-NAS program, their journey begins with compassion and support, not judgment. The goal is the same: meet people where they are and walk with them on the path to recovery.
Because rural communities have their own unique set of needs and barriers to accessing healthcare. Healthcare from a hospital or a clinic or a provider may be very far away for them to travel. They may have transportation challenges. There's lots of evidence to support that folks will not travel over 40 miles to access healthcare. And then as far as the infrastructure or the lack thereof in rural communities, a lot of folks don't have access to broadband, so they don't have access to telehealth. Our driving purpose is to ensure that all individuals in all rural areas have access to health care. It's really those organizations like Starting Point Behavioral Health Care, Inspire to Rise, the Community Coalition Alliance. These folks are the ones that really do get the benefit of seeing their work affecting change and a positive outcome.
Still, even the best care can be out of reach if stigma gets in the way. Stigma doesn't just silence, it isolates. It turns moments of vulnerability into shame, which keeps people from getting the help and support they need. In rural communities like Nassau County, where everyone seems to know everyone, that stigma can be especially heavy.
Stigma shows up in community settings and also in professional settings because people don't understand sometimes the mental health or the substance aspect.
At the core of real change is understanding. When we grasp the reasons behind someone's struggles, it opens the door to empathy, not judgment, and creates a space for true support.
Yes, a lot of people judge individuals if they use substances, and that's one of the things where I think we were trying to make sure we eradicate. But at the same time, too, I think it's big on educating people about what's kind of going on, so they can kind of know, hey, just because a person has been using substances, or we had a substance misuse disorder, that's not the end of the road.
Some common misconceptions are that people chose this lifestyle, that they're always going to be like this, that they're never going to get better. But really, it's just one moment in their life. And do we really want to define people by one moment that they are not proud of? I know that I'm not proud of certain moments in my life. I'm thankful and grateful that those moments have not defined me forever, that I've been given the opportunity to become who I am today. And I think everybody should be given that opportunity.